Good morning, friends. If you are benefited from these sessions, please do subscribe and share with your friends. The series of movements that occur in the head in the process of adaptation during its journey through pelvis is called as mechanism of labor. The engaging anteroposterior diameter is suboccipital abrachmanding. The engaging transverse diameter is biparatal diameter. The visible passive movements of head due to the untwisting neck sustained during internal rotation is resuscitation. The movement of rotation of head visible externally due to internal rotation of shoulder is known as external rotation of head. Photograph is devised by Friedman. Dilatation of cervix is that centimeter per hour in a primary and that centimeter per hour in a multi. It is 1 centimeter per hour in a primary and 1.5 centimeter per hour in a multigravida woman. Bleeding in and after plasmal separation is normally 100 to 250 ml. The type of labor in which labor starts before 37th completed week counting from the first day of last menstrual period is called as preterm labor. The protein which binds fetal membranes to decidua is fibronectin. The presence of dash protein in cervico-vaginal discharge between 24 to 34 weeks is a sign of preterm labor. Fibronectin. Dash drugs are given to mother to reduce the risk of respiratory distress syndrome and intraventricular hemorrhage. It is glucocorticosteroids, or that is mainly betamethasone 12 mg 24 hours apart. 2 doses are given. Which position preferably prescribing to mothers who are at risk of preterm labor? It is left lateral position. Premature or pre-labor rupture of membranes is spontaneous rupture of membranes at any time beyond that week of pregnancy, 20th week of pregnancy, a state where periodic watery discharge occurs probably due to excessive decidual glandular secretion is known as Hydria Gravidarum. The condition in which liquor amni gets infected is called as chorioamnionitis. A pregnancy continuing beyond 2 weeks of expected date of delivery is known as post-maturity or post-term pregnancy. The field of uterus in the post-maturity is full of fetus field. Length of postpartum baby will be greater than 54 cm. All fetal death weighing 500 gram or more occurring both during pregnancy and during labor is known as intrauterine death. The hypothermia of the mother -degrees Celsius can kill the fetus. 39.4 degrees Celsius can kill the fetus. Characteristic ultrasonographic sign in IUD is Spalding sign. Appearance of gas shadow chamber of heart and vessels in a dead fetus in ultrasound is Roberts sign. Alteration in the size and shape of pelvis of sufficient degree so as to alter the normal mechanism of labor in an average size baby is called as contracted pelvis. Characteristic type of pelvis as a result of disease ricket early childhood is known as rachitic flat pelvis. Type of pelvis caused by softening of pubic bones due to calcium and vitamin D deficiency and lack of exposure to sun rays is known as osteomalacic pelvis. The pelvis produced due to arrested development of one ala of the sacrum is known as Nagler's pelvis. Disparity in the relation between head and pelvis is called as cephalopelvic disproportion, or in short we call it as a CPD. Conduction of spontaneous labor in moderate degree of CPD under supervision with a watchful expectancy, hoping for a vaginal delivery is called as trial of labor. Any deviation of normal pattern of uterine contraction affecting the course of labor is known as abnormal uterine action. The type of incoordinate uterine action in which there is localized spastic contraction of ring of circular muscle fiber of the uterus is called as contraction ring or constriction ring. The failure of cervical dilatation is known as cervical dystocia. In that labor, the combined duration of first and second stage is less than 2 hours, precipitate labor. The tonic uterine contraction and retraction is otherwise known as Bandel's ring or pathological ring. The commonest malpresentation is breech presentation. The Burns-Marshall presentation method and malaflexion and shoulder traction, that is modified Morigos-Millie weight technique, associated with breech delivery. Condition in which presentation of fetus constantly change even beyond the 36th week of pregnancy is known as unstable lie. When there is more than one presenting part present at the time of its presentation is known as compound presentation. Abnormal descent of umbilical cord by the side of presenting part is called as chord prolapse. Condition in which the cord is placed by the side of presenting part and is not felt in PV examination is called as occlude prolapse. Condition in which the cord slipped down below the presenting part and felt lying in the intact bag of membrane is called presentation. Labor when combined duration of first and second stage is more than 18 hours is known as prolonged labor. Type of labor in which descent of presenting part is arrested due to mechanical obstruction is called as obstructed labor. Abnormally large baby weighing more than 4 kg is known as fetal macrosomia. The wide range of difficulties encountered in the delivery of the shoulder is known as shoulder dystocia. Commonest cause of postpartum hemorrhage is atonic uterus. Secondary postpartum hemorrhage occur in dash days of delivery, 8 to 42 days after delivery. Primary PPH occurs within dash hours following birth of the baby, within 24 hours. Condition in which placenta not expelled out even 30 minutes after birth of the baby is known as retained placenta. The condition in which placenta is adhered to myometrium is known as placenta accreta or morbid adherent placenta. Thank you for listening with me.